the overactive bladder. This is a very common condition both in men and in women, more in women in particular, and also in children. While this is a condition which is of no serious consequence, it does affect the quality of life significantly. Simply put, the overactive bladder is a condition where the urinary bladder behaves with a mind of its own. Normally, in the act of urination, we are able to go to the toilet when we feel the urgent desire to do so. However, in this condition called overactive bladder, the bladder dictates the terms and makes you want to run to the loo. If you don't get there in time, it is likely that you may actually wet yourself, causing an embarrassment not only to yourself but to the others around you. This is a condition where most people know where the washrooms are located in every part of their cities. And if they go to a new town, the first thing that they would like to know is where are the washrooms. They do not want to have an accident. While, as I said, this condition is more affecting the quality of life, it can be a serious problem in children in particular, where as a consequence of certain neurological conditions, the bladder becomes very active and causes this condition where when the children are at school, they may have the urgent desire to pass urine, and if the teacher does not allow them to go to the washroom, they might actually wet themselves. They just then become the laughing stock of many of their peers in their classes. In men, this condition does occur, but invariably as a consequence of either a neurological problem or when there is an obstruction to the actual flow of urine. Apart from the fact that these patients have a strong desire to pass urine, which in urological language is called urgency, they can also have tremendous amount of urinary frequency both by day and by night. And as I said earlier, if they don't get to the toilet in time, they can actually wet themselves, and this is a condition which we call as urge incontinence. It is important to know that people who suffer from this condition need not feel any embarrassment. Multitude of treatments are available, starting from medications to certain interventions. And it is important for the patient concerned not to hide themselves in their homes, but to come out and seek the opinion or the help of their friendly urologist, who can help them and guide them to a better quality of life. Simple treatments are available like bladder training, reducing the amount of fluid intake, drugs, and also intravesical medications which actually have improved the bladder functioning and improve the quality of life of these individuals.
Visit www.asecondopinion.in to book a telemedicine video consultation with experienced doctors and address all your health concerns today.